Hi, we are the GI girls and we did our project on colostomy irrigation. A colostomy is formed when part of the colon is redirected to an opening called a stoma on the abdomen wall. There are numerous reasons a patient may need a colostomy. Some reasons include bowel obstruction, diverticulose, cancer, or infection, and they can be permanent or temporary. There is a theory and practice that irrigation of the colostomy helps patients have a better control over when they will have a bowel movement, which gives the patients more control over their life, therefore improving their quality of life.
We decided to investigate the difference between standard colostomy care with colostomy irrigation versus standard colostomy care on its own. Standard colostomy care requires the patient or healthcare provider to remove the colostomy bag, wash the stoma and skin around the stoma with a washcloth or soft towel, mild soap, and water. After patting the area dry, a skin barrier may be applied to prevent irritation of the skin. Then the new colostomy bag will be applied. If the colostomy bag opening does not fit the stoma, it is important to cut the bag to the appropriate size. The seal between the wafer and the skin must be tight to prevent leakage. Then snap the new colostomy bag on and standard care is complete. It is important to burp the colostomy bag if it becomes full of air. Irrigation of the colostomy bag will help to regulate bowel function, helping the patient to regain control of his or her life. To irrigate, the patient or healthcare provider will obtain an irrigation container and fill it with about 1 quart of lukewarm water, hanging the container to head level after attaching to the stoma. The patient will sit upright, and in about 5 minutes the irrigation will be complete. The patient should not have cramps or discomfort, as this is a sign of rapid irrigation. Over the next 45 minutes, the patient will have bouts of defecation. Once this is complete, the patient can cover their stoma with a small stoma covering or colostomy bag and continue with their daily routine.
Based on the research found in our articles, colostomy irrigation has been found to be a beneficial intervention for patients. Evidence has shown that standard care alone is very effective, which is the reason it has always been used in practice. Colostomy irrigation, along with standard care, takes the effectiveness one step further by improving the patient's quality of life. As mentioned before, colostomy irrigation allows patients to have better control over their bowels, which ultimately leads to better control over their schedules and life. In one research study, nurses of the wound, ostomy, and continence nursing were asked if they believe colostomy irrigation should be regularly taught to patients. Over half the nurses responded in favor of colostomy irrigation, claiming they felt it could only benefit patients when implemented with standard care.
We have good and consistent evidence. While there's nothing wrong with the current practice of colostomy care, we suggest the implementation of education of colostomy irrigation to all patients who undergo colostomy surgery. The data has shown that both patients and nurses see the value in colostomy irrigation therapy. Patient quality of life and confidence significantly increased after colostomy irrigation therapy and allow for a more comfortable life. The patient will be able to have confidence in social and intimate situations. The only downside seen to colostomy irrigation therapy and educating patients on the therapy was the time commitment associated. However, through implementing education of the therapy, the patient will be presented with the knowledge and supplies to carry out the therapy. It will be up to the patients if they would like to maintain the therapy in their daily lives.